As we know, hospitals and other organizations are trying to gobble them up. Private equities coming in here. The doctors that try to, maintain that, I want to see them grow because I see, this is just my opinion. What are your thoughts on this real quick? We're seeing access is starting to back up, right? You see these bigger telehealth players trying to come in and taking patients away from doctors. But then, a lot of people are left out of care, right? I know, especially underserved communities, a lot of them just don't have access to the doctors that they used to, right? And rural healthcare is getting devastated. So that private practice, primary care, physician, so vital, needed in healthcare. But I do see that a lot of these doctors are leaving and it's hurting, populations. That's kind of what I'm seeing, but I don't know if you feel the same way, but I feel like it's so vital for more doctors to take the entrepreneurial spirit on and do their own thing. I mean, what are your thoughts on that?
I think they want to. They're just scared to do it themselves because they don't know, one, if they're doing it right. And I really feel like a lot of them don't realize there's people out there like consulting groups like mine that can help them. And I think that's
Gotcha.
the biggest thing. Like they're scared to do it, but they don't realize there's somebody to help them, such as myself. And then when they do see somebody to help them, they're like hesitant to spend the money. But reality is they're going to be so much farther along using somebody and then also getting help with like, because we bring to the table more than just like there's so many ancillary opportunities that they could do. Like my whole
Absolutely.
goal is to help increase revenue without increasing patients. If you have enough patients like you, we look for ways to help these doctors make more money because as we all know, like insurances keep paying them less and less and less. So our job and my job is to help figure out like, okay, how else can we make you money that benefits your patients? And it's not something you don't want to do it to all your patients. It's not
Mhm.
something about that. It's how can we help you make more money, but also that's a value added to your patients and truly does bring them help. So I think that's a big thing of what I see.
Yeah, I like that. They want to do more. They're just scared. They're not aware. And so
And
the
they're not
goal
sure
is to,
how else they can bring in more money if like they start losing patients. But again, there's people out there to help them figure out how to get more patients and other opportunities out there that you wouldn't get if you worked for a hospital.
absolutely. Yeah, I've heard, you're going to pay one way or the other. You're going to pay on the front end to learn the stuff you need to do, or you're going to pay on the back end when you have to unscramble all the messes you made
Yeah,
because you didn't know
from
what you were doing.
all
And
the money
so,
you lost from like
yeah,
not
exactly. So
doing
it's,
enough in the
I
first
think,
place.
yeah. Exactly. So I think it starts with like what you really want to do. If you truly believe that's where you want to go, then go ahead and spend the money now to be successful. So I
Exactly.
agree. And I know you and I as business owners, I spent thousands of dollars on training and updates to keep my business going. So definitely I understand that aspect as well. So the fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about the healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.